State plans to make healthcare affordable, deliberated, or rather, state plans to make healthcare affordable, deliberated. There's a proposal to reduce the doctors' fees by 20%. Currently, the doctors' fees are between 3,600 and 7,500 shillings, and some of the doctors representing officials representing the doctors have opposed this proposal, saying that it's going to disrupt how the profession is run. And I'm just wondering, because there are several issues that have been happening or occurring in the country, talking about patients who lose their lives in the line of medication and how the bodies have to be detained. When we talk about the access to healthcare, the universal healthcare, and then these fees, how much of debate should we have in as far as this is concerned to ensure that even the doctors' fees are reduced?
Well, I think it's not a bad debate to have on the doctors' fees in as far as reducing cost of medical care. But we must look at what contribution does it make. What is the contribution of the doctors' fees to the overall cost of care? Mm-hmm. And as someone who's interacted with the health system, mm-hmm. it's not a big proportion. Mm-hmm. I think we are splitting hairs now when we go to that level. Mm-hmm. What we need to be talking about is overally, mm-hmm. how can our people actually access access care in the first place? When you talk about consultancy fees and so on, mm-hmm. you're not dealing with the issue of primary health care at the very lowest level. Because what you're talking about now is people who come to consultants. Mm. You have dispensaries, for example, in our villages. They have no medicine. Mm-hmm. There is no medicine. You go there, you find a clinician who will see you, or a nurse or a clinician who will see you, and then there's nothing. Mm. There's nothing for the person. When you go to the referral hospital, there's no medication at all. So we are dealing with a broken health system. Mm-hmm. But I think we are beginning the debate in a very high place. Mm-hmm. So what are we talking about? Because first of all, we must talk about healthcare at the very lowest level as you rise. All cases right now, if you go to, sub-district hospitals, they now all must be sent to, the referral hospital in the county. Mm-hmm. And many of our referral hospitals in the county are unable to function because there's just no, especially no drugs, there are just no medicines, nothing. There are no services. The services are broken. That is why you find everybody coming to Kenyatta. Everybody is ending up at KNH. Mm-hmm. Is this what I think? When I saw this debate on doctors' fees, I just wondered whether this really is the place mm-hmm. that we want to start the debate on fixing our healthcare. And when we saw the universal healthcare plan mm-hmm. launched in Kisumu last month, I think that is a step in the right direction. Mm-hmm. And our counties must now step up. Because, everything we want to blame the national government, but healthcare is devolved. Right, once we told our people that they can access free medical care, mm-hmm. I think the one statement that the Minister for Health made on that day is, with this launch, mm-hmm. we must roll our sleeves and now see that when our people actually come to access this universal health care, mm-hmm. the care is actually there. Mm-hmm. So for me, this debate on doctors, it's good to reduce it by 20%, but it's not really the biggest of our problems at this point.
I know your home county is not Kisumu, but it's one of those pilot counties. Has there been any change since that launch of UHC?
I think it's too soon to say, because this was, just December. Then people went to the festivities. I think it is now the time to go and start looking in this month of January how things have improved.
But, yes, but professionally, as a lawyer, I know there are also legal fees that are provided for by the LSK and your laws and regulations. When you begin such kind of a debate to alter the charges, how does it reflect on, how does it affect the professional bodies of this country?
Well, from where I sit, I think that's not a legal issue. It's not a professional body issue from where I sit. To me, this is an economic issue. And to me, the solution lies in structural problems that bedevil our society. We need to put more effort in what we call supply-side economics, meaning the government should, number one, look at, should strive into increasing the number of doctors who are graduating from our universities. It can offer incentives for people who are doing medicine vis-a-vis other courses, so that we draw more students to do medicine. By doing that, if you have a situation where more and more doctors are graduating from the university, then you are going to see these fees naturally coming down. I say that because, for instance, when you have asked an issue concerning lawyers, we now have about 16,000 lawyers. As a result, by the way, legal fees have now started coming down because the numbers of lawyers are now just too many, and therefore, when they compete, there's no doubt about it, that causes the fees to come down. So the same principle should apply in medicine. If you want these fees to come down, ensure more and more graduates are graduating with a degree of medicine. And that can be done through offering incentives, preferential treatment for people doing medicine. So that instead of a person who has an A going to do other funny courses, he is drawn to doing medicine. Number two, we should also
funny courses. You know, this is
no. It is true. No, I strongly believe, and I'm sure you can confirm that. You see people coming seeking employment from you, right? I'm sure you have ever seen a person with an A or even an A minus coming to seek employment. You wonder, assume that person did medicine. Are you saying that person, from where I sit, will be contributing better to the society? So we need to encourage people. Don't do a course that has no guarantee of employment. You're a bright person. Do medicine.
Right.
Number two, and most importantly...
But even though not everyone is qualified for that,
well, that may also include probably considering lowering pass mark for doing medicine. It does not necessarily mean you are going to affect the quality of the output, because when you have an A minus or a B plus, you are as bright as a person with an A. Be that as it may, let me also comment. Most counties are not devoting enough money towards healthcare. The Abuja Declaration provided that counties or government generally should have at least 15% of their budget going for healthcare. Currently, for instance, in Murang'a County, very few resources are being devoted to health. If we were to at least ensure 15% of our county's budget is going to health, you are going to have a situation where that money comes down.
But how do you do that, also looking at the fact of the matter that there are so many other sectors that need to be financed?
Of course, an issue of priority is an issue of priority. Health is a key priority. Life expectancy in any part of the world is usually very conjoined with the healthcare. So you capitate more money into health sector, people live longer and they have better quality of life. So instead of concentrating more into, let's say, building road, for instance, you have to do what is called do a SWOT analysis, or you do which of the sectors make more sense. And from my argument is health makes all the sense. It's so crucial. So, for instance, a county like Murang'a, at least 20% of its budget should be concentrated in healthcare, because when you do that, you are going to improve the people's livelihoods.
Great. And have you tried to make that argument? Yes,
we have been doing that, pushing counties to do so, also even Murang'a counties. But then again, the executive or the governor, he has the discretion. He's the chief executive officer of a county. It depends on what platform he was elected by the people. By the way, some counties have done a good job. Let me commend my friend Mr. Oparanya. He's building a multi-billion hospital in Kakamega. Some other counties are also doing a good job, but some other counties have really neglected healthcare. You find, for instance, there are so many people who are clinical officers who are jobless. There are many nurses who are getting out of our KMTC who are jobless. To me, if you are to put more money into that sector, you may have to absorb those people into that area and improve our people's livelihoods.